Okay, it is 1:30 Mountain Time, and so we are going to go ahead and kick off this latest webinar in the CONVERGE webinar series. My name is Lori Peak, and I serve as the principal investigator for the National Science Foundation funded CONVERGE facility, which is headquartered at the Natural Hazard Center at the University of Colorado Boulder. And CONVERGE is dedicated to connecting researchers across disciplines to advance ethical, interdisciplinary, convergence-oriented research that is problem-focused and solutions-based. On behalf of our entire team at CONVERGE, as well as the Natural Hazard Center, it is our pleasure to welcome you to today's webinar. Today, during this brief 30-minute webinar, we are going to share the latest CONVERGE training module, which focuses on public health implications of hazards and disaster research. And we are really excited to share this new module with you today, and we're very grateful that you've joined us for this webinar. And sorry for the delay, everybody. I'm having a bit of a hard time getting the slides to advance on my screen. There we go. Okay, thank you. So a few logistical items before we proceed any further. Please note that this webinar is being recorded and that we will post the caption recording as well as the slides on our CONVERGE website at converge.colorado.edu. And if you have any questions or comments at any time, please do put them in the chat box. Please note that one of the major tasks of our CONVERGE project is to accelerate the education and training of a diverse next generation of hazards and disaster researchers and practitioners. We recognize here at CONVERGE that disaster research is often highly event-driven, and in order for our field to progress, it is crucial that those new to this area of study have access to already existing research and an understanding of various methodological approaches and potential ethical challenges that can come with hazards and disaster research. And so to help, our CONVERGE research team has created a series of free online training modules that are specifically designed for students, emerging researchers and practitioners who are new to the field, and others who hope to quickly background themselves on a variety of key topics and key information in this area of study. So to date, we have actually released 10 training modules through CONVERGE, and these are all available for free for completion via the CONVERGE website at converge.colorado.edu under the resources tab. And these modules that we have available focus on a range of topics of interest, of wide interest in our field. So topics like social vulnerability to disasters, disaster mental health, cultural competence, and several others. And as you're going to hear about today, our latest module is again focused on public health implications of hazards and disaster research. We wanted to offer special gratitude to the International Association of Emergency Managers, or IAEM. Thanks to a partnership with IAEM, we're now able to offer one contact hour of general management training for each completed CONVERGE training module through the IAEM certification program. And so if you're going for an advanced emergency management certification, we hope that you will visit our CONVERGE website and learn more about how you can gain credit for completing these modules through the International Association of Emergency Managers. We also wanted to make sure and draw your attention to one of the many free resources that we have available on the CONVERGE website. And so because we hope that these CONVERGE training modules will not only be used by individual researchers and practitioners, but that they also may be adopted in classrooms or used for other competency requirements, we've actually created a CONVERGE training modules assignment bank. And in this assignment bank, you can find several model assignments that are posted on the CONVERGE training module web page that have been used in undergraduate as well as graduate classrooms. And there are a lot of really innovative and exciting assignments that educators across the nation and as well as around the world have contributed to this bank. And so if you're an educator out there who has used any of the CONVERGE training modules in your class, we hope that you will consider sharing your template of your assignment with us so we can publish it on the CONVERGE website and hopefully help other educators who might want to adopt your assignment in their class. The training module that you're going to hear about today was actually made possible through supplemental support from the Centers for Disease Control and Prevention, or CDC, which was transferred to our base award at the National Science Foundation. As we really want to acknowledge and thank our partners at the CDC who worked with us every step of the way on completing this training resource. And we also wanted to acknowledge that the idea to develop this training module actually came about as a result of our CDC-funded Public Health Disaster Research Award program that we administer through the Natural Hazards Center. And so please know that over the past 2 years, we have actually funded more than 24 research awards that are focused on advancing novel public health and social science, as well as interdisciplinary research that is focused on advancing research in the 5 inhabited US territories. And one of the things that we quickly realized in working with the researchers and research teams was that while the research itself was outstanding, that oftentimes the researchers needed some additional guidance in terms of how to make sure that the implications, the public health implications of their research was clear. And so with that in mind, our team set out, led by Alexa Hansen, who you're going to meet today, Courtney Walton-Mitchell, Rachel Adams, and Candace Evans, our team set out to create this module that would help not just public health researchers, but researchers across a variety of disciplines in engineering, the social sciences, the natural sciences, and the humanities who are doing hazards and disaster research to better articulate what are the public health implications of your research and how can your research findings help to improve population level health. So that's where we're going to go today during this webinar. With that context in mind, we're now going to turn to the demonstration portion of our time together today. And you're going to have an opportunity to hear from the wonderful Alexa Hansen, who is both a research affiliate here at CONVERGE in the Natural Hazards Center. She's a graduate of the wonderful Colorado School of Public Health, and she now works full-time as an epidemiology response planner for the Colorado Department of Public Health and Environment. And as you can imagine, Alexa has been working around the clock in response to the COVID-19 pandemic. And in addition to all of that work through the Colorado Department of Public Health and Environment, Alexa also served as one of the lead developers for this module. And she brought to this work an incredible level of academic as well as applied and professional experience. And her expertise, along with that of the other members of this development team, again, including Courtney, Rachel, and Candace, who are all on this webinar, really helped this module content come to life, in addition to the excellent feedback that we received from our partners at the CDC. And with that in mind, I'm now going to put myself on mute and turn the controls over to Alexa, who's going to give us some more background and context on the module itself, and then she's going to do an actual live demonstration of the module. So Alexa, over to you.
Thanks so much for the introduction, Lori. Hello, everyone. As Lori mentioned, my name is Alexa Hansen, and I worked on reviewing the literature and developing the narrative that appears in this module. So today I'm going to start by providing a brief overview of what public health is. At its core, public health focuses on the health of populations rather than the individual. Considering health on a population level requires thinking about how our natural, physical, and social environments intersect to affect communities. From conducting scientific research to communicating information about health, public health works to assure the conditions in which people can be healthy. And ensuring optimal health before, during, and after disasters is an important part of this mission. With that in mind, I'm now going to provide an overview of the public health implications of hazards and disaster research training module. What you can see right now is that the public health implications of hazards and disaster research training module is organized into 3 lessons. Lesson 1 focuses on public health and disasters. Lesson 2 includes case studies with public health implications. And lesson 3 helps the user to identify your own public health implications. And overall, this module takes about 30 to 60 minutes to complete. Each of these lessons focuses on different topics and a specific set of learning objectives. For example, by the end of the module, participants should be able to explain how disasters impact population-level health and public health systems, describe the role that the public health workforce has in mitigating, preparing for, responding to, and recovering from disasters, identify opportunities to incorporate public health frameworks and tools into hazards and disaster research, critically review hazards and disaster research case studies that have implications for public health systems, practice, and policy, recognize how hazards and disaster research can promote health equity, reflect on public health outcomes and consequences of your work, and identify specific public health implications for hazards and disaster research. In the online module, on the right-hand side of the page, there's a tracking bar where you can monitor your progress as you move through the module lessons and topics. Once you've completed a topic, you can always go back and review at a later time. I'm going to show you some content, including some of the case studies and examples we present throughout the module. So disasters both directly and indirectly impact the health of communities. And accordingly, public health plays an important role in each phase of the disaster management cycle, from mitigation preparedness to response and recovery. Disaster work conducted at state and local health departments is guided by the Centers for Disease Control and Prevention's public health preparedness and response capabilities. Throughout the module, we provide case studies, examples, images, and infographics to illustrate content. In the public health and disasters lesson, we first define public health's role across each part of the disaster life cycle, and then present a series of case studies to illustrate that role. So for example, mitigation encompasses actions taken to prevent or reduce the effects of a disaster by attempting to reduce risk, control anticipated damages, and limit impacts on people and the built environment, as well as health and the social infrastructure. Public health plays an integral role in this process by assessing the needs of populations and identifying how vulnerability to hazards varies across different groups. So to illustrate this, we present a case study where researchers use the CDC's Social Vulnerability Index to study the relationship between social vulnerability and heat-related health outcomes. This is one of the many concrete examples in the module that emphasize how public health can contribute to improved hazard mitigation, preparedness, response, and recovery by identifying populations most at risk for negative disaster impacts. In addition to the module's written and interactive visual content, we've compiled a wealth of additional resources helpful for educating yourself about the field of public health and understanding the public health implications of disaster research. By clicking the Additional Resources tab at the top right-hand corner of the screen, you can find links to public health frameworks, tools, trainings, and other relevant resources. And importantly, you must be logged into the module to access these resources. At the end of the module, you can take a 10-question quiz to assess what you have learned. If you are an instructor considering these quizzes for classroom use, please know that we have a question bank that uses a random generator. So if you assign this to your students, they will not all get the same questions. If you get at least 8 out of 10 questions correct, you will receive a certificate of completion with your name and the date. You can save the certificate as a PDF and can also access it at a later date through your training module account. All right, we're now going to turn to the demonstration portion of this webinar. And while Lori is getting the screen ready, For the demonstration, Katie will add a link to register the training modules in the chat. I'm now going to walk you through a demonstration of the public health training module. So this module covers a number of important topics related to public health implications of hazards and disaster research. And for the sake of time, I'm going to guide you through the portion of lesson 2, case studies with public health implications, as well as one of the interactive activities that we included in lesson 3 to illustrate how you might use these modules in your classroom or other learning environments. So lesson 2 presents examples of hazards and disaster research from multiple disciplinary perspectives that have important implications for public health. These case studies span 6 different research topics related to mitigating, preparing for, responding to, and recovering from disasters. The cross-cutting research topics overlap with key capabilities and functions identified in the CDC's Public Health Emergency Preparedness and Response System and include environmental hazard assessment, coordinated response, social vulnerability, risk communication, mass sheltering and care, and workforce development. And this first topic in the lesson is environmental hazard assessment. Hazard assessments, such as the Federal Emergency Management Agency's Threat and Hazard Identification and Risk Assessment, or THERA, and the Centers for Disease Control and Prevention's Jurisdictional Risk Assessment, can help us understand what public health risks communities face and develop strategic plans to address them. The case study we included here presents an example of research involving assessments with important public health implications. In this example, after the Deepwater Horizon spill of 2010, a group of chemists and environmental scientists at the FDA conducted research on the contamination of fisheries along the Gulf Coast. Through this work, they developed risk criteria and thresholds for allowable levels of contaminants in each type of Gulf seafood. This research has several important public health implications, which we highlight here. For instance, monitoring of the contaminant levels helped provide information about the impacted area to decision makers in the affected populations, as well as allowed the FDA to develop risk criteria and establish thresholds. These criteria, in turn, guided public health policy in terms of the decision to close fisheries to protect the health of the communities, including promoting environmental, occupational, and food safety. The next topic in the lesson discusses coordinated response. While responding to a disaster, public health may take a lead or supporting role depending on the type of event and related health implications. Either role requires a coordinated response across multiple agencies and partners. This typically follows a National Incident Management System, or NIMS, unified command structure, which brings together the incident commanders of the major organizations involved in the incident in order to coordinate an effective response, while allowing each organization to fulfill their own jurisdictional, legal, and functional responsibilities. So here we have another case study that highlights how local, state, and federal public health agencies partner to respond to the Flint, Michigan water crisis, using research to inform efforts that can improve environmental health infrastructure and population health during recovery. So rather than continuing to show you this lesson, which follows the same format through several more case examples, we wanted to take this opportunity to show you the last lesson of this module, which invites users to put their knowledge into action by developing their own public health implications in response to 2 case studies. Our hope is that by demonstrating this portion of the module today, you will walk away with ideas of how you might incorporate these activities and the module itself into your classrooms. The lesson begins with a set of questions that can assist with understanding the public health implications of hazards and disaster research. These questions are intended to serve as a guiding point for reflection on the public health outcomes and consequences of one's work and can be downloaded as a PDF. For the sake of time, I will only walk you through the first part of the activity, which focuses on a case study of the physical and mental effects suffered by children exposed to the Deepwater Horizon oil spill. The 2010 Deepwater Horizon oil spill resulted in the release of an estimated 4 million barrels of oil into the Gulf of Mexico, leading to various negative environmental, socioeconomic, and health consequences for communities in the area. For example, a study published by the Daisy and colleagues found that children who were directly and indirectly exposed to the disaster impacts were more likely to experience prolonged physical and mental health consequences compared to unexposed children. The research team collected 720 household surveys from parents in Gulf Coast communities. The data showed that 3 out of 5 parents reported their child experienced adverse physical health outcomes after exposure, and 1 out of 3 parents reported that their child had adverse mental health outcomes, including anxiety, stress, or depression. Children in these communities were physically exposed to chemicals, oil, and tar balls through contaminated beaches, food, and water. They also felt the socioeconomic effects on the communities, such as the economic hardship experienced by many families who lost their job due to adverse impacts on the fishing, seafood, and tourism industries. Job loss can result in inadequate food, nutrition, and healthcare access for children, as well as increased levels of stress and depression within the family. Ultimately, findings from this research suggest children who were directly exposed to physical hazards or economic hardship following the oil spill, especially those in low socioeconomic status households, were at increased risk for suffering from a variety of physical and mental health consequences. Now we're going to turn the focus over to you all and have you complete this activity. If each of you will please take a moment to reflect on what you see as the primary public health implications of this research and type your answers into the chat box here on Zoom. So if you were taking this module, you would type your answer into the response box here and then click Finish Assessment to move on to the next page. The module then brings you to a new page where we provide a few possible examples of public health implications users might have thought of, such as helping to guide a more effective resource allocation to address unmet population health needs. Note that while we do not grade these responses via Converge, this can serve as an excellent assignment for your classes or for a discussion starter in the context of the classroom. For example, we have heard from some faculty members who use our modules in their class, have students complete the module for the certificate, then have them bring their responses to questions like this into the classroom to help with classroom conversation. We hope you might share with us how you use these activities in your own education and teaching. Finally, I want to point out that one more thing during this demonstration, and as discussed earlier, the module has a resources tab where additional resources are listed that can support researches and practicing reciprocity. These resources include public health frameworks, tools, trainings, and other relevant resources. Each of these resources is also hyperlinked. So for example, if I press the 10 essential public health services link, it will bring me to a webpage for that resource. I also want to note that we have an annotated bibliography that includes all the references cited in this module. You can find that bibliography in the Learning Management System, or it's available for download on the CONVERGE website as well. And that concludes our demonstration today. We're now going to return to the webinar slides. We hope this webinar has been helpful to you today. I'm now going to turn this back to Lori for some concluding comments. Lori, back to you.
Thank you, Alexa, so much. And thank you for demonstrating that module and for all of your and the team's work on it that has helped it to come to life. And we hope that everybody who's out there today on the webinar will complete the training module and share it with others. And so before we close out today in our final few minutes, just a few brief announcements from the team. We wanted to let you know that we are now working on the 11th training module in the CONVERGE series, and this is in partnership with Chris Gibb and several of her students at the University of Ottawa in Canada. And so this module is actually focused on positionality in hazards and disaster research, and is actually an outgrowth of one of Dr. Gibb's assignments in her class, where she asked her students to actually write up a CONVERGE training module using the format of these modules. And so Candace and Rachel are picking up on the work of Dr. Gibbs's students and are moving this forward. So this will be the next module in our series. We also, as has become tradition during these webinars, we wanted to give our viewers a quick update on where we are at in terms of registrations and completions. And so to date, we're almost up to 5,000 registrants. So 4,911 people, including students, academics, government officials, private sector professionals, and others from across the US and around the world have registered for the training modules. And thus far, 1,876 people have completed the social vulnerability training module, which was the first released in this series. 1,221 have completed the disaster mental health module. 840 have completed cultural competence. 439 have completed the IRB module. 318 have completed the emotionally challenging research module. 132 have completed the understanding and ending gender-based violence in fieldwork module. 259 have completed the broader ethical considerations module. 177 have completed the collecting and sharing perishable data module. 27 have completed the reciprocity module. And as of today, 58 people have already completed this recently released public health module. We look forward to seeing your name on a completion certificate very soon for this new module and any of the other modules that are available in the series. To contact us about any questions or suggestions that you might have, we hope you'll reach out to us at converge@colorado.edu. Candace regularly monitors that email address, and so please do reach out to us, and know that you can register for and access the CONVERGE training modules as well as this module recording on our CONVERGE website at converge.colorado.edu. As just another note of gratitude, again, this module that you heard about today would not have been possible without the support of the National Science Foundation, as well as the Centers for Disease Control and Prevention, who not only provided funding, but also intellectual support, guidance, and partnership. And we are so grateful. We also want to acknowledge the entire team here at CONVERGE and the Natural Hazard Center. Everyone here, from our undergraduate students to our most senior staff, contributed to this module in some kind of way, whether it was reviewing or writing content, testing the module, or otherwise helping it to be published online. And so thanks to our team here. Thanks to all of you who took the time to be a part of this webinar. We are at the end of our time today, so if you do have questions or comments, We'll stay on for a minute or so if you want to drop those in the chat box, and we will follow up with you later, or feel free to email us at converge@colorado.edu. On behalf of Alexa and myself, again, thank you so much for joining us, and have a wonderful rest of your Friday. And please remember to take care of yourself and others. Thank you, everyone.